afternoon to everybody. My task is to open this experience of the surgical oncology webinars. And my task is to talk about the curriculum in surgical oncology. My name is Sergio Sandrucci. I'm a surgeon and I'm the chair of the European Society of Surgical Oncology Education and Training Committee. The question is why a curriculum in surgical oncology? Why do we need something so specific? Because there's a huge variation in training of surgical oncologists. There have been surveys about that, and there is such a difference that the standardization of learning and of preparing people for this task is not that easy. We have to underline that surgical oncology is not the same thing as general surgery. There are two different specialties. Surgical oncology per se is a subspecialty of general surgery. Surgical oncology is much more than surgical expertise in diagnosis, cure, or palliation. Surgical oncology means understanding the balance between surgical and non-surgical treatments. So be the leader of the multidisciplinary approach. We know that there are so many types of surgery in oncology. We have preventive surgery, diagnostic surgery, staging surgery, curative surgery, debulking surgery, palliative surgery, and supportive surgery. And all this kind of surgeries be decided within a multidisciplinary environment. What are the fundamentals of surgical oncology? The fundamentals of surgical oncology were stated by an American surgical oncologist whose name was Blake Cady, that in 1978, so the former century, stated that talking about cancer care, the biology of cancer is the king and the patient selection is the queen. And our maneuvers, technical maneuvers or therapies, are prince and princess who long to reach the role of queen and king. But they trying to overthrow the powerful forces of king and queen sometimes win temporarily, but usually they have no long-term success. So we have to know very well tumor biology as surgical oncologists, because understanding tumor biology is critical for deciding when to operate, what operation to do, and when not to operate. To select patients is very important because of the performance status of patients, because of nutritional status of patients, and because of the staging of our patient. All these three elements contribute to the quality and the effectiveness of clinical and oncological course. So they can affect response to therapies and, most important, the compliance. Surgeons who spend all or most of her practice time in cancer care must have the latest information, and maybe they are able to deploy the most reliable treatments. Why? Because the cancer care is of increasing complexity, and the knowledge of oncology advances every day. There are expanded opportunities and of research related to biology. And we have not to forget that surgeon has a very important role in coordinating the management of cancer patients, even those with early disease. We have to keep in mind that the majority of patients with cancer refer to a surgeon for the first time. So this surgical oncologist has to be able to coordinate all that. He had to be able to coordinate it himself with other specialties related to oncology. So the multidisciplinary approach is of paramount importance. Why is that important to deal with the education of surgical oncologists? Because the incidence worldwide of new cancer cases is increasing. As you see, it will nearly double in 20 years. But as you see, the percentage of new cancer cases is slightly higher in the less developed regions of the world. And this percentage will not change that much in time. What it will change very much is cancer-related mortality, which nowadays is, these figures refer to the 48% in the less developed regions of the world. But in 2035, there is a sort of forecast of a 70% of cancer-related mortality in less developed regions of the world. So the need of a proper education, a proper the need to remove all the obstacles to cancer care is very important. As you see, surgery, among all the weapons we have against cancer, is very important, because nearly 80% of cancer patients will need surgical intervention at some point. As you see, there is a increasing need for surgery. The forecast of that is very important in the world, and also in different countries with different incomes. And there is a significant variation in surgical oncology training. This is a very important work that was made by the Lancet Oncology Commission, talking about the quality of cancer surgery. And they stated that significant global variations are linked to the slight variations in oncology training. And this variation can have a detrimental effect on tackling the rising of cancer burden, and can enhance inequalities in cancer care. If we see what are the barriers to cancer care, yes, there is a lack of affordable basic population health care provision, that's for sure. There is also lack of cancer awareness, so a matter of population education. There are cultural barriers at presentation, and there is a problem of resources. But one of the most important barrier to cancer care is the inadequate number of trained personnel. I'm talking about trained personnel. We have to talk about surgical oncologists, or that is, surgeons educated in management, not surgery, but management of patients with various cancer diagnoses. And an adequate surgical oncology workforce depends from the development of an educational system that is able to promote training and maintaining competency. To do so is very important to provide a scaffold, a foundational scaffold for essential common requirements for training surgical oncology professionals. So this is the reason that why a surgical oncology core curriculum has been developed. This scaffold, we will talk about it later, is designed to permit adaptation to disease burden variations and the cultural and the different economic realities of diverse countries. So it's not a rigid model. Getting back to a study about the variation in training of surgical oncologists, you can see that, taking in consideration Africa region, Eastern Mediterranean region, and Europe region, you see that there is a huge difference in the total training length between the different world regions we are considering. We are talking about surgery, but talking about surgical oncology, the difference of postgraduate surgical training and fellowships is slightly different between Africa, Europe, and Eastern Mediterranean. So this inhomogeneity in training is very clear and very, I can say, upsetting. It's quite unlikely that a subspecialty aptitude like surgical oncology can be achieved in the course of a generalist surgical training, which provides a better heterogeneous exposure to cancer surgery. So a core curriculum is pivotal in planning and implementing a training program. A core curriculum in surgical oncology must be made of 4 principal issues. One issue is considering the core domains of general oncology for the surgical oncologist. It's considering core domains in pre, peri, and postoperative surgical care for the surgical oncologist. It deals with essential competencies and essentials of core knowledge domains of surgical oncology, that is the organ-specific or district-specific surgery. In details, the core domains of general oncology for the surgical oncologists are very wide, as you can see here. Surgical oncologists do have to know something about epidemiology of cancer, screening, the main chemotherapy regimens, the use of radiation therapy in certain kind of cancers, the effects. They have to be familiar with chronic pain management, palliative care, imaging, and pathology, and all the things that deals generally with cancer. Talking about the pre and post-operative, apart from surgical procedures and techniques, surgical oncologists have to be familiar with patient selection, decertification, operative planning based on imaging, the good way to obtain a consent for operative procedures, and some principle of post-operative critical care. And there is one peculiar part that is the essential training core competencies, that is to have this, to learn how to behave as an oncologist. So the surgical oncologists have to attain competency in holistic patient care, in interprofessional and communication, in system-based practice, and also you have to understand the human or compassionate side of medicine. This is the easiest part because the surgical oncologists have some essential of core knowledge of each specific disease site, but the idea is that the surgical oncologists have to specialize in districts like is upper GI, lower GI, breast, or HPB, or others. But he have not to ignore completely the principle of treatment of cancers in other districts. He has to be able to select people and to address people, to coordinate people, address people to the right specialist, to the right care track. The surgical oncology training is different if we consider US or Europe. In the 80s, the Society of Surgical Oncology moved forward to approve some training programs, but as you see, with little numbers. Was after this date in June 2009, it was founded the subspecialty certificate in advanced surgical oncology. That it means that the surgical oncologists had to deal with complex general surgical oncology. That is, that the general surgeon can deal with cancers, but the more frequent or the less complex cases. As much as 19% of cancer care in the United States is delivered by general surgeons. But the diplomates in complex general surgery has to be called to handle the more challenging, rare, unusual, or recurrent tumors. That is the meaning of this specialty in the US. And what about Europe? In Europe, the situation is less homogeneous. We, as a European Society of Surgical Oncology, joined with the UMS, that is the European Union of Medical Specialists, with its section of surgery. We, as I said, we are running two examinations. One examination in surgical oncology and one examination in breast surgery, as you see. This exam is designed to certificate that the surgeon has a knowledge across the breadth of cancer surgery with advanced level expertise in their own specialty discipline. And the standard of the exam is set at the level of a full quality cancer specialist surgeon that works to the latest European quality standards and protocols. This is in this moment, in this historical moment, this qualification is probably the only specific qualification that is existing in Europe nowadays. When you perform this exam, you achieve the title of fellowship of the UEMS. That is a significant high-level indication of professional competence and excellence, and reflects the important European standardization and harmonization and quality assurance process in medicine. There are, of course, eligibility criteria for this examination, that as to have a current license to practice as a general surgeon, a certificate of specialist training from the European Union, or even specialization achieved outside Europe. You have to, who wants to apply to this exam has to produce some documents that are the proof of surgical experience, the proof of their qualification, and the proof of academic outputs. Talking about experience, the candidate has to retrieve the 3 years of surgical activity, ranked by his role and the quality and the quality of surgery. He has to certificate his specific interest in cancer. The requested standards are a minimum of 2 years in a designated oncology center or in a clinical surgical oncology setting plus a research fellowship, or 3 years if the experience was not in a designated oncology center but with a main interest in cancer surgery, or in case of working in a designated oncology center but with 1 year of surgical oncology clinical fellowship. So there are some minimal standards. We adopt the a core curriculum, that is this ESO core curriculum that was published in 2013. Now in this period, we will update this core curriculum in 2020. This core curriculum nowadays is standardized with the Society of Surgical Oncology curriculum, the American one, and we called it the global curriculum. This is the content of this curriculum that reflects what I told you about what a surgical oncology is. So there is a part talking about basic principle of oncology, and this is the outline of the core curriculum. So talking about the carcinogenesis, these are the requested knowledge about this. There is a part of the core curriculum which talks about disease site specific things. So as you see, I'm showing as an example the HPV section. So we are talking not only about technical issues, but also with incidence, sociology, genetics. And here there's the part regarding the generic clinical skills. So radiology interpretation, preoperative assessing, preoperative care, and so on, as I told you before. We have, as a society, a suggested textbook, which is the surgical oncology textbook that was written by the Education and Training Committee members. There is a sort of discount for this book if you are an ESO member, in which you can find all the things that are described in the core curriculum. As you see here, this is a snapshot of the index. You see basic principles and so on. How to apply to the exam? You can apply through the website, the UMS website. This is the cost of application, and there are the total cost is 600 euros, 250 for the eligibility assessment, non-refundable, 350 for the practical exam that you have to pay after your selection. The exam is split in two parts. One written part and an oral part. The written part is the first part, which selects the candidates, is an online remote exam. After the evaluation, if you fail, you can try again the written exam, but if you pass, you have to go through an oral examination. The remote exam, now is an online exam. The written exam is held in different places in order to allow the people to try the exam without moving or without moving in a certain place, but they can mostly go in their own country. As you see here, we have all these countries at this moment, but the number is increasing. The exam is held in the same date every year, in June, and the list of location is published after opening of the application process, that is in more or less in March or April. You can, as you see, choose the location as a first and second, third choice. This is an example of this is a multiple choice question exam with 60 questions. 40 about general surgery oncology and 20 about clinical parts. You have 2 hours, and this is a question preview. And all the candidates have the same questions, but in randomly assigned. So your neighbor in the computer doesn't have the same screenshot. So it's not that easy to cheat for this exam. The questions come from a bank of questions that ESO owns. We are ranking the difficulty of these questions by this ANGOP system, just to be in sort of equal in evaluation. And if you pass the written exam, you go to the oral exam. The oral exam is split in 2 parts. A viva case discussion, a paper discussion. The viva case is aimed to evaluate clinical management skills, decision making, and clinical knowledge of current practice. The commission prepares 10 cases, and each candidate discusses 2 case scenarios themed around the specialty the candidate has chosen, HPV, upper GI, colorectal, or breast. You have to declare your preference about the subject about which you want to be examined for. This is the example of the VIVA case. To the candidate, we give the imaging, we give the description of the case. The red part are the questions we examiners tell to the candidate. So the candidate has only the black text to examine it. And after that, you go to the paper discussion. The papers are chosen among the most representative papers in surgical oncology. They are allocated again on the declared preferences, and the exam is focused on critical thinking, trial design, and methodology. Why? Because the surgical oncologist has to be able to read in a proper way literature, has to be constantly updated. And the joint commission of ESSO and the American Society, SSO, has written also the principles for research literacy. And why? Because the understanding research literacy helps the surgical oncologist to interpret or navigate the research in oncology. You know, there is a huge number of papers that are published every day. So the main thing to know is to interpret or navigate the literature. And here, for the possibility also, it helps you to start cancer-related researches when circumstances permit, of course. At the end of the exam, there is the you have a certification. That is a certification. Sorry, it is a certification of the European Board of Surgery. So there is a quality certification concerning your skills and your knowledge about being a surgical oncologist. And so, what to take home from this webinar? We need a curriculum, because the education environment, training structure, and pathways and regulations are extremely variable across the world due to social, cultural, and economic factors. So the aim of a global curriculum is to provide a foundational scaffolding or requirements for training surgical oncologists. Of course, it may not be equally applicable to all countries or regions of the world, being redundant for regions, whereas some modules could be out of the reach or not applicable to others. However, we have to keep in mind that from a global curriculum, we sort the foundational requirements for training surgical oncologists. And these foundational requirements are uniform in order to provide an optimal cancer care. And thank you for your attention, and thank you for questions or any discussion.
Hello, sir.
Hello?
I am Dr. Samah from Egypt.
Okay. Good evening.
I am Dr. Samah. I asked about GO course.
Yes.
He look like the European Board of Surgical Oncology.
Yes, you have the written exam in Egypt. You're coming from Egypt, I mean, right?
I have to pass a written exam.
Yes.
He look like the European Board of Surgical Oncology, not examination in the internet only.
Mm-hmm.
I have to pass a written exam.
For the examination, you have to have the written exam and the oral exam. There is a European certification. You're living in Egypt, or
Yes.
you're okay. We had a deal with the Egyptian Society of Surgical Oncology.
Yes.
For the written exam in Cairo. So we have
Yes.
people from Egypt that are following this exam. This exam is a certification of your knowledge of the core curriculum. This is the meaning of my webinar is that I was talking about the exam because the exam is not is the practical part, the practical application of this curriculum. So that the curriculum is acquired and is a part of the surgeon's culture.
But what is the aim of the GO course? The GO course is a free course. Okay. The GO course is a free course. From the Harvard University. They look like the European Board of Surgical Oncology. I have to pass a written exam and a practical exam, not online examination.
You're talking about courses, aren't you? Yes.
I suppose that the course is a free course from Harvard Global Course for Surgical Oncology.
Yes, I was. You're right. There is nothing bad about this. I'm just underline the fact that I was talking about this exam not as a compulsory thing to do. Is one the means that we have nowadays to certificate the things I said, but any other, it depends on the local regulations of local rules. It's important that any kind of exam or any kind of course you follow are held according to this curricula, because the global curriculum is the surgical oncology curriculum is recognized by the European Society and by the American Society of Surgical Oncology. So I think is how can I say, made by consensus of great experts.
Yes. But what society I communicate for the written exam? The Egyptian Society of Surgical Oncology?
Yes, you can take your information from the Egyptian Society, because as I told you, Egypt was the first country in which the written exam was held.
Yes. Okay.
Okay, thank you. Looking this question here, is possible for countries in America to become partner country for surgical oncology fellowship students to take the exam? Yes, of course. I'm talking to Abakin, that is writing from Guatemala, and yes, possible to apply to the ESO exam. To have a surgical oncology fellowship, as you saw, is without doubt an added value in the selection process. So any kind of problem. You have to keep in mind that the exam gives you a certification of quality, a certification of proficiency, but it doesn't allow you to entitle yourself as a professional, because it's not recognized as specialty. Local, national regulations or academic regulation to recognize it as a specialty. You can certify that you're expert in, but you are not a specialist in. It's not like an academic entitlement. I want to be very clear about this. How can I get a curriculum? You can download it from the, I show you here. we have the, okay. You can download it from this website. That is the European Society of Surgical Oncology website. You can download the ESO core curriculum, and you can download also the global curriculum that was published in the European Journal of Surgical Oncology or the Journal of Surgical Oncology at the same time in 2016, more or less.